On the day of surgery, it is important to have your joint coach with you for all therapies and nursing education. You will be fitted with compression stockings after your surgery by your nurse. You will likely need assistance with putting on and removing compression stockings. Remove the stockings to bathe. Be very dry prior to putting stockings back on and after bathing. Using a plastic bag to put the stockings on makes this process somewhat easier. Your therapist will explain this process to you while you're in the hospital. Do not use powders and/or lotions to assist with putting on stockings. The stockings are to be worn until your follow-up visit with your orthopedic surgeon. To clean stockings, hand wash, drip dry. Do not put stockings in a washing machine or dryer. You are allowed to take a shower the day after surgery. Use great care with getting in and out of the shower and/or bathtub, as you are a high risk for falling after surgery. Your occupational therapist will review this process with you. You will likely need to sit on a chair or bench when bathing. Due to the decreased strength in your post-operative leg and high risk of falling, it is difficult to move out of the way of your shower head when sitting on a chair or bench to bathe, so a handheld shower is also a recommended piece of equipment. Grab bars and bath mats are also a very good idea in your bathroom as well. The dressing over your incision will be water resistant. It is okay for this dressing to get wet, but not okay for this dressing to be submerged in water like taking a bath. This dressing is to stay on until your follow-up visit with the orthopedic surgeon, typically 10 to 14 days later. If your dressing starts to peel, have dark spots under it, or not look correct, please contact your orthopedic team. Getting dressed can be difficult after surgery. To ensure that you are safe and to make this process easier, please sit to put on your lower body clothing, such as underwear, pants, socks, and shoes. When putting on pants, shorts, and underwear, begin with your surgery leg first. Wear comfortable clothing such as sweats, shorts, or pajama bottoms. Wearing these types of clothes will also allow an easier process for toileting. You may benefit from using adaptive equipment for dressing, such as a reacher, sock aid, long-handled shoehorn, and elastic shoelaces. If necessary, your occupational therapist will review this with you. Walk frequently to avoid joint stiffness, but don't walk far, as this can cause increased joint pain. Be functional. Walk to the bathroom, living room, and kitchen. Most patients have an increase in pain on day 2 and 3 due to the pain block wearing off. By post-op day 4 or 5, your walking distance will gradually increase as your pain decreases. It's expected that you will have increased swelling in your new joint by post-op day 2 to 3, with potential loss of range of motion as well. This is a normal healing process. Do not use heat around your new joint, as it can cause increased swelling. Instead, use frequent ice and elevation to decrease swelling. Most total joints experience significant bruising by post-op day 3 to 5. When you discharge home, your joint coach needs to go everywhere you go. You are at a high risk for falling after surgery due to the stress of surgery and anesthesia. It is very important that you carefully avoid falling and the consequences. Remember, under no circumstances are you to fall.